Welcome to Lesson 10 of the Family Caregiving Program, Toileting and Perineal Care. This is a vital component of assisting with activities of daily living. I am Dr. Thomas Scotton's avatar. Please note, these lectures are for educational and informational purposes only and do not constitute medical advice or treatment recommendations. All caregiving decisions, including medication and physical care, should be made in close consultation with the individual's physician and qualified healthcare professionals. Our purpose today is to provide respectful, hygienic assistance with toileting and perineal care while strictly preserving the person's privacy. We aim to promote continence, protect the skin from damage, and recognize changes that require urgent medical attention. To reach these goals, we have 5 primary learning objectives for this lesson. Let's break them down. First, you will learn to prepare the environment and assist with toileting using the person's specific mobility and continence plan. Second, you'll master providing front-to-back perineal care using a clean to dirty technique and appropriate infection precautions. Third, we will cover how to protect the skin from moisture, friction, pressure, and the use of unnecessary products. Fourth, you will learn to recognize critical changes in urine, stool, and skin that must be reported to a clinician. Finally, we'll discuss how to preserve consent, modesty, and the person's identity throughout every intimate care interaction. Few caregiving tasks are more private. An older adult may feel embarrassed, exposed, or even afraid of falling during this time. Because of this, your approach matters just as much as your physical technique. Respect is the foundation of safe care. To guide our approach, we use the PALS rhythm: prepare, ask, understand, support, and evaluate. Start by knocking and asking permission. Prepare the environment before you begin to avoid any rushing. Understand the person's preferred words for toileting. Using their language reduces discomfort and shows respect. Support their independence. Evaluating what they can safely do themselves, like adjusting clothing or wiping. Never scold or show disgust. Incontinence is a health condition. A calm, matter-of-fact approach protects dignity. Safe toileting starts with the plan. Does the person walk, use a commode, bedpan, or a wheelchair? Keep the route clear and well lit. Ensure grab bars and transfer devices are within reach before urgency becomes an emergency. Gather your supplies: gloves, toilet tissue, warm water, mild cleanser, towels, and a disposal bag. Include absorbent briefs or pads if used, and a set of clean clothing. Always have everything ready first. Offer toileting regularly. Scheduled intervals like on waking or after meals can help prevent accidents. However, the schedule must fit the individual's needs and patterns, not force them into a rigid routine. When providing physical assistance on the toilet or commode, we use the LEARN framework to communicate. Listen to their concerns and explain every step before you move. I'm going to lock the brakes now. Acknowledge their privacy needs. Stand just outside the door or turn your back if safety allows. Recommend the safest position and negotiate the level of help needed. Always encouraging self-care first. Perineal care cleans the genital and anal area. The golden rule is always move from clean areas toward dirty areas. For a person with a vulva, clean from the urinary opening toward the anus front to back. Never wipe back to front. To ensure thorough care and safety, we use the ACT model: assess, capture, and tell. Assess the skin for changes. Capture the dirt by using a clean portion of the cloth for every single stroke. Use fresh cloth surfaces until the area is clean. Rinse if required, and then pat dry. Do not rub. Finally, tell. Report any findings to the nurse or clinician, such as new redness, swelling, or drainage. Older skin is easily damaged. Avoid vigorous scrubbing, harsh soaps, hot water, or deodorant sprays. Apply a thin layer of moisture barrier as directed. Avoid powder clouds, which can irritate the lungs. Several factors can cause temporary incontinence. These include urinary infections, constipation, and lifestyle factors like excessive caffeine intake. Medication side effects, limited mobility, or confusion can also be reversible contributors that deserve clinical assessment. Longer-term causes might include an overactive bladder or pelvic floor weakness. Clinicians may recommend specialized therapy or bladder training. Never simply hide a new problem with products. Report any new leakage, urgency, or difficulty starting to the medical team immediately. Urinary incontinence affects many older adults, but it is not a normal part of aging that you must just accept. Reversible causes like infection or medication effects can be treated. Always seek a medical assessment. Report new burning, pain, urgency, or difficulty starting. Cloudy urine with symptoms is also a concern. Visible blood, pink, red, or smoky brown urine must be medically evaluated even if it only happens once. For stool, note new diarrhea, unusually hard stool, or the presence of mucus or pus. Note the frequency. Black tarry, maroon, or bright red stool can indicate bleeding. Call emergency services for heavy bleeding or shock signs. When reporting urine changes, include context. Cloudy urine with symptoms or a new lower abdominal pain should always be evaluated. Note changes in consistency and color. Pale, clay-colored, or greasy stools deserve clinical review to identify the underlying cause. Seek immediate help for heavy bleeding, fainting, or severe weakness. Do not attempt to diagnose the cause yourself. If the person refuses care, stop and ask why. They might be cold, in pain, or embarrassed by the situation. Offer a different time, a preferred caregiver, or a simpler approach. Never restrain or shame the person. If a person becomes distressed during care, stop immediately. Offer a preferred caregiver or a simpler one-step approach to reduce anxiety. Always explain before touching and keep all private information private. Your calm presence is essential for their comfort. Let's reinforce what we've learned with 5 quick questions. I'll pause after each to let you decide. Question 1. In which direction should perineal care move after a bowel movement? Front to back. Question 2. Is urinary incontinence an inevitable and untreatable part of aging? No, it is treatable. Question 3. What skin changes should be reported? New redness, rash, warmth, or swelling? Question 4. Does strong-smelling urine by itself prove a urinary tract infection? No. Report it with context. Question 5. Which stool colors can signal bleeding? Black tarry, maroon, or visible bright red blood. Stop and get help if the person cannot urinate, passes blood or clots, or develops a fever along with urinary symptoms. Get help for severe abdominal, side, or back pain, or if stool is black, tarry, maroon, or contains bright red blood. Report skin that has persistent discoloration, blistering, an open area, or spreading redness. These are signs of serious breakdown. For fainting, severe weakness, confusion, or heavy bleeding, call 911 immediately for a medical emergency. Respectful toileting care protects far more than cleanliness. It protects comfort, health, and human dignity. Thank you for completing Lesson 10. Please download your workbook for the full safety checklist and action plan. Remember our 4 key takeaways. First, always clean from front to back using fresh cloth surfaces. Second, remember that incontinence is common but not inevitable. It can often be treated or managed. Third, inspect and protect the skin during every episode of care to prevent damage and infection. Finally, report meaningful changes in urine or stool along with the person's symptoms and baseline. This content is for general education and not individualized medical advice. Follow your specific care plan and clinician instructions. Call 911 for emergencies. Thank you for watching. Visit famcareclass.com for more resources.